Welcome back. I want to talk to you today about nursing process and care plans. So, what if there's one key thing in nursing school that's going to help you with exams, that's going to help you with patient care, that's going to help you feel like you know what you're doing? That one thing that you probably learn to hate just a little bit is nursing process. And I think it's because you don't appreciate it and understand it fully. So, the sooner that you can do that and start using it daily, the better and easier nursing school is going to be for you. So let's jump right into it. This is going to be part of a series. Today, we're just going to talk about an overview of nursing process and a little bit about its history. Nursing is an applied science, meaning that it takes a whole lot of knowledge to figure out what to do. Another part of that applied science is that nursing is also an art. And so that means that a couple of different nurses could have the very same task, do things very differently. And as long as it meets the standard of care and the needs of our patients and public that we serve, then it's all good. And so it is very nice that you have that autonomy in nursing and that you can develop your own art and way of doing things that is professional and meets the standard of care. It has, of course, also stood the test of time. So let's talk a little bit about that history. In 1896 is when the American Nurses Association was established. And as you can imagine, healthcare was very different. We didn't have all these specialties. There wasn't respiratory therapy, occupational therapists, physical therapists. The nurses did it all. And so it was very important that those that were trained in the profession of nursing were able to give orders and leave instructions for those that continued the care behind them. And so that's where we kind of ended up with the terminology of nursing orders. As you've probably have figured out, there's a whole lot of things about nursing that we're supposed to know how to do that there's not written instructions for anywhere. And so that is part of this nursing process and our problem solving process that's unique to us. In the 1950s is when Ida Jean Orlando started her theoretical work on the nursing process as we know it today. In the beginning, it only had 4 steps. It's evolved from 4 to 5 to a lot of different steps, and we'll talk a little bit about language in just a little bit. But the most important thing that she put into the nursing process was Maslow's hierarchy of needs. And as you know, that is a theoretical framework for psychology that its premise is that we have basic safety and physiological needs that have to be met before higher level of needs can be attended to. And that would include psychosocial needs, self-esteem needs, self-actualization, and things like that. So Maslow's hierarchy of needs is integrated into everything. Nursing process is integrated into everything. And so in the 1970s, the North American Nursing Diagnosis Association was established, and they defined a certain set of nursing diagnosis that said these are the an official diagnosis that we're going to use, the set of problems that nursing is specific to take care of. It really is our standard of care and helps define our scope of practice. So from that, each state, and once nurses had to actually be licensed, state boards of nursing developed their nursing practice acts, and that's legally binding and what we are obligated by law to do. Within every state, there are very commonalities, and the 4 top commonalities are that we will assess, we will report, safely administer medications, and initiate a plan of care and maintain that follow-up care. So from that standard of the profession, accrediting bodies recognized nursing as an official profession, and they also started to incorporate the nursing process into their accreditation standards. So you may already know that if a hospital doesn't meet its accreditation standards, then they don't get funding from Medicare or Medicaid or other entities or contracts with private insurance companies. And so those accrediting standards and the fact that they would recognize nursing and use our same standards says a lot. You'll find those same accreditation standards in schools. You've probably noticed that the nursing process is written down in your clinical evaluations, in your learning outcomes. When you're licensed and have a job, a lot of your work evaluations will have the nursing process in it. So it is absolutely everywhere, and it is essential to what we do. As the nursing process has grown and our attempt to make sure that we understand and implement it correctly, terminology has changed over time. So we went from the 4-step to a 5-step that's listed here and a 6-step that's listed here. The 6-step I particularly like because I think it is more indicative of the actual steps that you take within the nursing process. I think it's more directional in what to do next, in other words. Clinical judgment model, that is based on Christine Tanner's theoretical work that was done in 2006. And it has ended up in more common day-to-day terminology that you are probably seeing in school and on different feedbacks from exams and that type of thing. Clinical judgment model is designed to help us with our thought process. So clinical judgment model is more specific to our thought process and not specifically to the patient. But you can see they are very common and really overlay. Kind of makes things a little bit confusing because they are so similar, but yet they are different. The clinical judgment model was incorporated into our new NCLEX test plan, or our current test plan, which has been in effect since April of 23. And how that happened is that they were noticing that a lot of mistakes were occurring by new nurses, and it was that they were failing to take action, which led them to believe that they were lacking in critical thinking skills. And so this judgment model of recognizing cues, analyzing cues, prioritizing a hypothesis, generating, taking action, evaluating our outcomes, again, is our thought process in the application of the nursing process. So a quick summary, the nursing process, no matter how you are implementing it, if you're looking at 4 steps, 5 steps, 6 steps, if you're doing nursing process as homework through care plans, concept maps, case studies, all of these things are essentially the same. Clinical judgment models should help you be able to implement and use the nursing process effectively. But a lot of it is very much all the same and just a play on terminology. It is a very fluid process, and again, it is essential for you to be able to recognize and appreciate and to start applying it now. And it will make so many things make much more sense and really help you throughout your nursing school journey. I'll end this series and every portion of our series with this slide with a QR code. I have written a book, Keys to Success, How to Study for NCLEX and Feel Ready for Practice. There's a lot of things within this book that are very usable now if it's not time for you to think about starting to get ready for NCLEX, and to just use on a day-to-day basis to help you with nursing school, your unit exams and things like that. So you can find more information. You can find a lot of free information at keystosuccesslballard.com. If you are a Kindle Unlimited member, the ebook is for free. If not, it's only $4.99 for the ebook and $12 for the paperback or written workbook. And so if you are close to getting ready for NCLEX, I really recommend the workbook. I think you'll find it much more user-friendly. But I want to thank you, and I want to invite you to the next set of series, which is the Anatomy of the Care Plan. Thanks, and have a great day.